Hi everybody, I am going to be talking about cognitive behavioral approaches to therapeutic recreation. And to start off with, the book gives a definition of cognitive behavioral theory, and it states cognitive behavioral theory is based on the idea that a person's thoughts or cognitions dictate how he or she reacts emotionally and behaviorally to any particular situation. So, in summary, thoughts lead to action. And so how do thoughts lead to action? There's several factors that can influence these actions. The most obvious, I would say, is that a person's perception of the event can lead to their response. So if I think that my roommate is not doing her dishes to get under my skin, then I'm going to react probably with anger instead of maybe talking with her about the situation and finding out that she just had a lot of homework and couldn't do the dishes that night. So we have a limited perception on things, and all of us are going to perceive something differently than others, but these cognitive theories can help us perceive situations in a different light and in turn react differently. And so other things that can influence people to act a certain way are fear and anxiety. So if someone is very fearful or anxious about a situation, they may in turn react out of fear or anxiety. And then the strength of the belief impacts the magnitude of an emotion. If I'm very passionate about a certain situation and am thinking a lot about it, then my emotion is probably going to be correlated to that magnitude. The intended groups for cognitive behavioral theory are going to be those that need help with their cognitions. And so these could include people that have phobias or anxiety, depression, adjustment disorders, personality disorders, or those who need help with different self-management skills. So that could be help with social skills training, pain management, or how to control their hostility or anger towards situations and people. So the type of treatment can be used depending on the specific population that it's worked with. One of the common therapies that is used is cognitive behavioral therapy, and that is a form of therapy that focuses on modifying both self-defeating beliefs and overt behaviors. And so use of cognitive behavioral therapy is effective for those with unipolar depression, anxiety, anger, and pain management. And it's effective for, not for all. I think, at least for me, when I thought of cognitive behavioral theory, I thought, oh, well, that's similar to cognitive behavioral therapy, so that's probably the common route to use for everybody. But that's not true. The book teaches us that it's used mainly for those who have learned cognitive tendencies and need to reroute those beliefs and cognitions to be something different. And it examines thoughts and it seeks to evolve them, turn them into different thoughts. So I found this nice chart for cognitive behavioral therapy for somebody that has anxiety. And this goes over 4 steps when you're working with this person. So this is a common 4 phases that occur. And first is that psychoeducation, so helping the person understand what the anxiety is. And then the cognitive restructuring step is to evaluate the anxiety and the thinking that comes with that, but also learning how to restructure those thoughts cognitively. And then that leads into managing anxiety on the body level, so using breathing techniques and relaxation techniques. And then that leads to step 4, which is the systematic desensitization, or gradual exposure to whatever is making the person anxious. So when you have those thoughts and behaviors restructured, it's easier to expose the person to that situation and help them work through something that they wouldn't be able to beforehand. There's also a therapy called rational emotive therapy, and this was created by Albert Ellis. And this is based on the assumption that people are very capable of rational thinking, but they also have a tendency to use unrealistic or illogical thinking when dealing with life demands. The foundation of this theory is going to be the ABC theory of personality. And this kind of goes through a list of steps for the therapist to help people get through these illogical thoughts and restructure those. So A is that activating event, and that activating event will trigger the belief. So if a person has an exam today, their belief could be, I must get an A on this exam. And if I don't get an A, I'm going to fail at this class. And so that's a little bit of an extreme, but these beliefs are usually going to be extreme. And that belief will lead to a consequence, such as the person getting overly anxious or panicked about the exam upcoming. This leads us to D, which is disputing intervention. And this is to challenge those irrational beliefs and change them into something a little bit different. So, for the example of the exam, the person could say, I would like to get an A on the exam, but I don't necessarily have to. It's not going to be the end of the world if I don't get an A. The next letters of the alphabet are E and F, obviously, but also for this example. So E would be the establishment of a new effective philosophy, and then F, which is a new set of feelings. So having those emotions and beliefs in line with each other and changing those to more rational thoughts. Other theories that the book mentions, but are just not as big as the other ones previously mentioned. So the first is constructivism, and this was developed by Jean Piaget. And this gives understanding to the individual so that they can learn how to act in a certain situation. So it gives people a broader understanding for how to react. Self-efficacy theory is how a person believes they can be successful, and these are determined usually by 4 factors, one being performance accomplishments, verbal persuasion, vicarious experience, and the emotional response. And then the third one on here is the attribution theory, which is a person's explanation for why events occur. And a person's attribution can then determine their motivation for an event. So those, if we can analyze their attribution, it can lead us to have a better understanding for why their motivation may be lacking and how to increase those motivations and restructure those thoughts. So for use in therapeutic recreation, there's a question that Sumbo and Wardlaw pose in the book, and this question is going to assess whether or not cognitive behavioral theory should be the foundation of your treatment for the client. And this question is the change agent of our program built around how clients think about or interpret their experience? So this is all about cognitions. So we're going to evaluate their cognitive distortions, and then using this theory can cope with emotional distress and pain. There's my references. If you have any questions, please list those below. I will try my best to answer those. But otherwise, have a great day, and I hope that you learned a few new things.